this is something which is extremely missing currently. We have a number of very, very sensitive diagnostics which are testing actually, especially in multiple myeloma, but also other diseases, if there's a residual disease, including liquid biopsies. But we don't know how really the immunotherapy which we are applying is working on the tumor, and if we do have really a good regression of the tumor, and especially if you think in myeloma of asecretory myeloma, you never know if you don't see any paraproteinemia anymore, if the patient's really in remission. So in order also to understand these treatments better, it will be important to develop these tools. And the most direct form of imaging would be to image the T-cell. And the T-cell is mainly doing the job. I mean, there are other cells which are also associated to that, NK cells, for example. And there's also a lot of innate mechanisms which are important actually in the immune response. However, it is clear that the T cells, especially the CD8 cells, are most important. And what we currently have in the clinics is nothing in this way. There are some clinical trials running targeting CD8 specific T cells, especially within CD8 actually specific tracer. However, our experiences are limited. And what is, in my opinion, extremely important is that you investigate with this imaging technology as well, that you don't harm the patient, that you don't deplete your T cells, because targeting T cells can be very easily associated to T cell depletion. And this is something which needs to be very importantly excluded. And what we have done in the past is we worked on different tracers to target T cells, and these are partially specific. As for example, the TCR beta, the murine TCR beta sequence, which we actually introduced, and also our T cell receptors. This is in humans then very specific. And we have learned that as smaller our molecule is, which we target, for example, when we use, for example, fragments, it's much better than full antibodies, because then we have a reduced risk actually for depletion of the T cells. And however, with this technology, we can just target actually transgenic T cells, which have a murine TCR beta sequence. So if you want to go for a pan-T cell marker, then you would need to go for another target. And what we have used in the past was, for example, CD2 and CD7. These are two antigens which are extremely highly expressed on T cells, especially specifically activated T cells. And we have shown in experiments that when we use fragments, again, we can target those molecules, especially CD7. With CD2, there's still a problem, and it's likely that you need even smaller molecules in order to target these antigens. However, what we have shown actually in the model is that this is well possible. And when we would have such actually tools in our hands, we would be then able to have this actually as a surrogate marker. So we could see how the T cells go into the tumor. We could understand if there's a T cell exclusion actually, or if they can infiltrate into the tumor. And we can see if they complete their job, if there's a whole completion by rejection of the malignant disease, or if there is something left. And what we can also understand is maybe a flare syndrome. This is actually when we see a tumor progression in the course of a immunotherapy, when the T cells actually get inflamed and proliferate in the tumor, and then you can have a pseudoprogression. And this is also what you could actually differentiate when you have these imaging tools. And I imagine that when we have such tools, that you can in time actually modify your therapy. You can, for example, add something which may improve the infiltration of the tumor by the T cells, or you can do something else in order to improve your therapy if you see that what you're doing is not enough. And you can also see a failure of engraftment of T cells. So if there is no signal, then you don't have T cells in the body, and maybe the adaptively transferred T cells are completely gone, and you would need to repeat that. And therefore, I think this is something which is urgently needed, actually, to improve our therapeutic skills.